Hi there, you're welcome to dummies Care channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos, and you can also help support us here at dummies Care channel. All right, so now let's jump right into today's topic. So today we're going to be talking about diabetes. Well, why is diabetes so important? Well, you're about to find out in a minute. All right. So what is diabetes? So diabetes is a metabolic disorder. So metabolic disorder in terms of when there's an abnormal change in our body, in the way our body breaks down certain substances, or in a way that it builds it up. So how does diabetes come into place? So first of all, let's talk about certain organs in our body that function in order to regulate our blood glucose. So in our body, we have the pancreas. So the pancreas is a small organ that creates something called insulin. And what the insulin does is actually controls how much blood glucose when we take a large portion of meals, and that meal get digested and broken down into smaller substance in our body, and that smaller substance can be used to provide energy. So what the insulin does is it comes in and tells the blood, hey, this is how much blood glucose that is needed in the blood. This is how much blood glucose, this is how much glucose from that food you just ate needs to be in the muscle or other places in our body where it can help us generate energy. So when there's an imbalance in how much insulin is being created, this can affect how much blood glucose stays in the blood. And this is how and where diabetes comes in. So diabetes is a condition whereby there is a higher amount of blood glucose inside our blood, and this actually affects the normal functioning of our body. So let's take a minute and discuss what happens with diabetes. So there are two main things that can happen in diabetes. This is when the body is no longer able to produce as much insulin, or the pancreas is lacking when it comes to giving the body sufficient insulin that it requires in order to be able to regulate blood glucose. Another part of diabetes is when our body is actually producing that insulin, but it's not being recognized in our body to be able to regulate that blood glucose. So today we're going to be talking about the combination of both, which is usually what happens in type 2 diabetes, where our body is either not producing enough insulin to regulate that blood glucose, or our body is creating that insulin, but it's not sensitive to that insulin that's being created. So our body resists that insulin and causes more glucose from that food that we eat to go into the blood, where it's actually not needed in a bulk amount. All right. So like I said, a proper manifestation of diabetes would be high blood sugar. So there are two main types. There's type 1 and there's type 2. So type 1 is when that pancreas is actually being attacked, and those cells that produce insulin are not able to produce that insulin because our body is actually attacking that pancreas. And this is usually an autoimmune disorder. If you don't know what autoimmune disorder is, when our body starts working against itself. So usually in this case, patients will have to outsource and get the insulin from another source, which is outside of their body. So patients will usually be on an insulin pump. For the other side, which is the type 2 diabetes. So patients with type 2 diabetes usually develop that low in a long-term period, which is kind of slowly creeps up, and your body just slowly stop making the insulin, and we're not able to kind of regulate that blood glucose. So that blood glucose continues to creep up until it becomes an actual issue and patients start feeling symptoms of that. So let's talk about classification of type 1 and type 2 diabetes. So like I said earlier, type 1 diabetes is more of an autoimmune disorder, and type 2 is usually more of a late term occurrence that happen usually because we as patients are not taking care of our body, or we're not exercising, or due to certain activity that's not being done to help kind of keep the body in motion and keep everything properly functioning well. So type 2 diabetes, like I said, it's usually a combination of our body not making enough insulin or our body resisting that insulin. While type 1 is just the beta cells are being destroyed in the pancreas, and so therefore the insulin are not being created and we need to outsource that insulin. So usually patients with type 1 diabetes are usually between less than 30 years of age, while patients with type 2 are usually more than 30 years old. So like I said, this usually creeps up and just kind of becomes a condition that's hard to treat later on down the process. So usually with type 1 diabetes, patients will usually find it as a sudden onset, where all of a sudden maybe the patient had an episode and just they pass out, and from checking their blood glucose, they see that their blood glucose is in like the 500 or 600, and then we know something's definitely wrong, and the doctor will run some tests to find out if the patient has a type 1 diabetes. All right, so usually patients will be more symptomatic in type 1 diabetes, meaning most patients will kind of feel as though something is wrong when this condition start happening, because they will start feeling the symptoms more often than normal. And usually, like I said, patients will have to be on insulin therapy because it's not being produced. So what about type 2 diabetes? So type 2 diabetes is usually happening in our patients that are much older, usually greater than the age of 30. And it usually kind of happens as a gradual onset. So it kind of slowly creeps up, and then the blood sugar kind of gets to a higher amount where the patient is no longer able to manage it. And then they end up at the doctor's office, and on some certain doctor's visit, they notice that your blood glucose is higher than normal, and then they would have to treat it. So usually patients with type 2 diabetes don't normally feel the symptoms, and they would, like I said, probably get to find out that they have diabetes after doing like a blood work at their doctor's visit. And usually our patients with type 2 diabetes, most of them are on oral medication. So they will have to take maybe like an oral tablet such as metformin, glipizide, and medications such as this to help control that blood glucose. If it's really, really high and their blood glucose are not able to be managed with oral medications, then the doctor will most likely put the patient on insulin. But this is usually not the first go-to medication, except their blood glucose is exceptionally high and the doctor really feels the need to have the patient take insulin in order to better control that blood glucose. So why is diabetes important? So first of all, diabetes is the 7th leading cause of death in the United States. Ouch. I know, right? So a lot of people have diabetes, and some people don't even know they have it, like I said, until they go for a doctor's visit and their glucose is maybe over 200, and the doctor says, yes, Miss Smith, or yes, Miss John Doe, we're going to have to put you on some diabetic medication because your blood glucose is high. So diabetes is usually common in our minority population, such as the Hispanic population, African American population, Asian American population, the American Indians, and the Native Americans. It's not very common in the Caucasian population. And total cost of undiagnosed or diagnosed diabetes is about 327 billion. So that's costing a lot of money to take care of our diabetes patient. That's why we want to create more awareness and make sure patients are knowing to check for their blood glucose as much as possible to see if they have this condition or not. So what are some of the causes or risk factors that can make someone have diabetes or kind of lead to somebody having diabetes along the line? So one of the first risk factor I would say is physical inactivity. So most patients, they call it couch potatoes. So most patients that don't really have enough physical activity going on, less exercises, not really moving around as much, these can later on down the line cause high weight and most likely down the line cause diabetes. Also, our diet as well as smoking can cause diabetes. What are some factors that we can't really manage? So usually in patients who have a family history of diabetes, the patient is most likely predisposed to that, and that may cause it down the line. So if you know you have a family history of diabetes, then you want to probably catch it early and make sure you're doing regular test or blood test when you go to your doctor's office if you notice any weird symptoms going on, and kind of make sure that they're keeping that checking that box to make sure that you don't have diabetes. Also our gender, the age, much older patients are more likely to get it. Also family history, genetics, like I mentioned, are more predisposed to having diabetes. So what are some signs and symptoms? So signs that the doctor's office look at when you go for your regular doctor's visit will be a fasting blood glucose greater than 105. So usually we want our fasting blood glucose to be between 70 to 105. Anything higher than that, then we might start looking at how to help the patient, whether it be lifestyle changes or through medications. And also, if this is not a fasting blood glucose for, people who don't know what that is, would be your blood glucose test being done, early in the morning before you've had anything to eat. So this is a measure of approximately about 8 hours of fasting where you haven't had anything to eat. So for patients who have had something to eat and they check your blood glucose and it's more than 200, which will be known as a random blood glucose testing during the day after you've had something to eat, higher than a 200 milligram per deciliter, then the doctor will most likely have to put the patient on some type of lifestyle management or medication as well. Also, another measurement that they take is the A1C. So the A1C is a measure of a 3 months of how your blood sugar is pretty much doing for a 3 months period. And it kind of gives a more accurate picture of where the patient is at when it comes to their blood glucose, and if the patient just has a high blood glucose for that day, or their blood glucose has kind of been high for the past 3 months before they did that blood work. So what are some symptoms to notice as a patient to take note of? So excessive thirst is one of them. So when you start noticing that you're becoming more thirstier than usual, trying to, drink more water, you feel like you need to drink more water, drink more liquids, you probably want to check that. Also, patients will have excessive hunger. They would want to eat more food, increased appetite to want to eat more. Also, patients have increased urination. They would tend to go to the bathroom more often to pee. Also, blurred vision. Some patients will have extreme tiredness or what they call fatigue. Also, in patients who have a chronic diabetes, they might find it hard for their wounds to heal when they have an open wound. Also, issues with weight loss. You might want to check to make sure that the patient doesn't have diabetes as well. So, like I said, these are the common symptoms of diabetes to take note of. These symptoms may happen with other conditions as well. So making sure you're going to the doctor's office to make sure that they're doing that blood work will completely help us know how to go further with treatment. So why do we need to treat diabetes? Why is it so important that I need to keep my blood sugar in check? So uncontrolled diabetes has a lot of long-term complications, and that is why you want to make sure you're treating it early. Patients can have brain damage from diabetes. They can have something called diabetic neuropathy when they have tingling sensations in their hands and in their feet or their toes due to nerve damage that's being caused by that high amount of blood sugar that's in the system. Also, high blood sugar can cause what they call diabetic retinopathy, where the patient actually starts to lose their vision because that diabetes is not under control. Like I said, diabetes can also cause tooth decay or something called gingivitis when there's like a gum disease going on or gum condition. Also, it can cause what they call diabetic nephropathy. So diabetic nephropathy is when the there's kidney damage due to that diabetes not being controlled. So as you probably know, your urine is being filtered by your kidney. So now imagine adding more sugar for your kidney to filter out. So your kidney is working overtime to filter all that sugar out. And in long-term period, it may cause kidney damage in that patient because they're having they're giving their kidney so much work to do. All right. So like I said, diabetes can also cause some other heart diseases. So that's why you want to make sure that you're checking to make sure that blood work is being done and the patient is being ruled out for not having diabetes. All right. So what are ways that you can prevent diabetes? What are the common ways to prevent it? So keeping a normal weight, make sure you're doing plenty of exercise, make sure you're watching your weight. Also eating healthy, making sure you're eating a balanced diet, making sure that you're not eating too much carbs, such as potatoes, rice, bread. So food that are high in carbohydrates, those are the food that you want to run away from. All right. Making sure that you're using your portion sizes. Still talking about diet here. So making sure that you're eating food in small portions. If you're going to eat a carb, make sure you're eating a smaller quantity. Try to supplement it for more protein. And also, this is also appropriate for patients with diabetes as well. Making sure that you're counting the amount of carbohydrates that you're taking in. That way you can help keep that carbohydrates that you're eating that's increasing your blood sugar, keeping those in check. Making sure you're exercising regularly, making sure you're going to your doctors to make sure that they're checking you, doing the blood work. Also avoiding smoking. So smoking is bad, all right? I'm sure you've heard this plenty of time, but avoiding smoke is actually avoiding smoking will actually preserve your lifespan. So this is something that we want to keep in mind before taking that first cigarette. All right, so that's all I have for you all today. I hope you enjoyed this video. Make sure you hit the like and subscribe button down below. You can also check out our website at www.dummies.com. DamienRxCare.com for more details and for more blogs that we have on diabetes and how to manage it. I hope this video was helpful to you. Thank you so much and stay tuned.